Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies and otherwise medically complex patients by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money, resources, whilst providing quality care at home. In last week's blog, I shared when a loved one is in the ICU, the symptom burden of family caregivers. You can check out last week's episode by clicking on the link below this video. In today's blog, I want to share what we are finding in our day-to-day work with intensive care at home clients. So this week's topic is home health care in Australia in crisis. Medically complex and ventilated patients are referred to the NDIS. The federal government has made around $16 billion available to fund the NDIS scheme for this financial year. Sounds like a lot of money, and it sure is. And it's great for people with disabilities, and it has been way overdue for such a wealthy and prosperous country like Australia to look after their disabled citizens. And yet, it still leaves home healthcare in crisis because most clients with medically complex issues that are not disability related, such as seizure management, ventilation, invasive and non-invasive, tracheostomy, PEG, cough assist, suctioning, TPN administration and unstable airway management are being referred to the NDIS. Those clients should never be referred to the NDIS in the first place because clearly all of the aforementioned clinical challenges are medical issues and not disability issues. All of the above mentioned clinical issues require specialist care and specialist ICU nurses in the home, like we provide, to manage seizures, ventilation, invasive and non-invasive, tracheostomy, PEG, cough assist, suctioning, unstable airway management and home TPN. To point out only the most common situations that require intensive care at home services with ICU nurses up to 24 hours a day. Currently, the state governments are trying to wash their hands clean by delegating state healthcare expenditure and clinical responsibilities onto a federal scheme that is unable to provide the resources and the expertise needed to deal with such medically complex health-related matters. How on earth should clients, adults and children requiring multiple ICU readmissions per year and taking up a $5,000 per bed day in ICU be looked after by an NDIS scheme that has nothing to do with health-related matters? And how on earth should adults and pediatric clients on long-term ventilation blocking ICU beds go home on an NDIS scheme that has nothing to do with medically complex issues and health-related challenges? The state departments of health are trying to delegate crucial and also life or death responsibilities onto an NDIS scheme that's simply not prepared for this. And it leaves innocent citizens and people in urgent need of qualified and skilled intensive home care nursing at peril. By state governments continuing to fund long-term ICU stays instead of intensive home care nursing, they continue to pay $5,000 per bed day instead of reducing the cost of an ICU bed by more than 50% and therefore provide quality of life for clients and their family at home in a holistic and family-friendly home care environment. Even worse, by inappropriately trying to delegate home health care and nursing responsibility to the NDIS, where funding for nursing care is non-existent, state governments are literally trying to discharge vulnerable and medically complex clients home with inadequate or no support, leading to life-threatening medical emergencies in a home care environment that lead clients back to ICU straight away, with dire consequences for clients and their families, but also for healthcare budgets. What's even worse is that the decisions are being made by the state health departments that have no clinical experience or exposure and don't understand the gravity of medically complex issues. In the meantime, state departments of health keep funding expensive and in-demand ICU beds for $5,000 per bed day a minimum, even though the cost could be cut to less than 50% by using intensive care at home services. State departments of health need to stop using the NDIS to try and delegate health responsibility onto a scheme that, number one, is not responsible for health-related and medically complex issues. Number two, the NDIS has no expertise to deal with medically complex issues such as seizure management, invasive and non-invasive ventilation, tracheostomy, PEG, cough assist, suctioning, unstable airway management, and home TBN. And number three, federally funded and states are trying to relinquish and delegate financial responsibilities on the federal government whilst they're trying to ignore their health responsibilities. Our services at Intensive Care at Home are evidence-based, and we have now provided services to dozens of patients, and the model clearly works. We clearly create win-win situations every single day, and we provide clinically appropriate services by sending ICU nurses in the home to keep patients out of ICU. I have also put some links below this video that will show you our evidence that we have published on our website, case studies, also the mechanical home ventilation guidelines. We also provide specialist support coordination for clients who have been referred to the NDIS but who need medical and nursing care instead of NDIS support. This specialist support coordination is actually funded through the NDIS, so we can actually bridge the gap between health and the NDIS. Please contact us on one of the numbers on the top of the website at intensivecareathome.com so we can help you to get funding for nursing care. And therefore, if you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, or also we can help you get your loved one out of a nursing home, or if you find that you have insufficient support for your loved one at home, or if you simply want to know how to get funding for our service, please contact us on one of the numbers on the top of the website at intensivecareathome.com, or send me an email to patrick@intensivecareathome.com. That's Patrick just with a K at the end. Also, have a look at our career section. We're currently hiring ICU and pediatric ICU nurses for clients in the Melbourne metropolitan area and in South Gippsland in Victoria. We are a TAC, DVA and Department of Health approved community service provider in Australia. We have also been part of the Royal Melbourne Health Accelerator program for innovative healthcare companies last year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.